to talk about depression and multiple sclerosis. Multiple sclerosis is a neurodegenerative disease. And if you or your loved one has that disease, you know that that means that the brain has a process where the sheath around the nerves, the coating of those nerves is getting degenerative or kind of eaten away. And so it has some direct effects on your thinking processes and some direct effects on how your brain can control parts of your body. So it's important to understand the relationship between MS and depression. In MS, there's an actual change in the physiology of the brain. So there are a lot of different things that can actually cause depression that have to do with just the disease of MS. One of them is that MS can change the levels of the neurotransmitters in the brain. And as we know, when those chemicals get out of balance, then your sense of well-being, your focus, your positivity can be dramatically affected. And you can refer to the symptoms of depression to sort that out. But people who have MS not only have a change in the chemicals in their brain, they frequently have chronic pain. Chronic pain has been shown to increase depression risks. Also, MS has a lot of effect on your personal life and your job. And so those changes, and as well as the lifestyle changes, giving up activities and things that you love to do or modifying them, can have a dramatic impact on you and increase your risk for having depression. Also, people who have MS tend to have poor sleep. And the reason is because they often have urinary frequency and urgency, so that gets them up at nighttime. They often have painful muscle spasms that can keep them up at night or wake them up at night. And they have a difficult time sleeping because oftentimes their brains don't wind down very well. So those are some things that we see in people who have MS. So sleep compromise, I think everybody knows sleep compromise will increase your risk for depression. Do all people that have MS have depression? No. About 40 to 50%, if you do the criteria of depression, you'll find have depression. But surprisingly, a fair number of people with MS do not. It is not true either that the more severe the MS, the more likely you are to have depression. So obviously people adapt to the changes of MS very differently as individuals. What is depression versus grief? Because you can imagine when you get the diagnosis of depression in MS, some people would be very inclined to say to you, well, you're just grieving, you're just sad because of all the changes from the MS. So depression is actually a physiologic change in the brain that occurs when the brain's health is changed. And depression does not indicate character. It should not be considered something that should be hidden or embarrassed about. It is not something that a person can will away or wish away or just use determination to get out of. So grief, on the other hand, is a reaction to a loss. It can be a reaction to a loved one. It can be a reaction to the loss of an ability. It can be a reaction to the loss of a life that you thought that you would have, loss of a job. So the difference between depression and grief is important. Whereas grief lessens over time, depression does not. Whereas grief has some change with circumstances, depression does not. Whereas grief has difficulty accepting what's causing the grief, depression is a focus on negative emotions just globally. Excessive focus on episode of grief or avoidance of thinking about grief or the cause of the grief can be signs of grief, whereas depression is more a preoccupation with self-worthlessness. So the other thing is that people who have feelings of hurting themselves, it's always depression. So if you or your loved one that has MS has symptoms and you're trying to sort out whether they are grief or whether they are depression, hopefully that will be helpful. And grief can be given some time to pass, but depression needs to be treated. What do we know about the symptoms of depression in people who have MS? What do we know specifically about that? Well, we know MS can affect certain areas of the brain. People who have MS are followed closely with imaging of the brain in the form of an MRI. We actually see that there are more There are certain people that are more at risk for depression depending on the region of the brain where the MS lesions are located. So we are actually learning more about depression, its symptoms and presentation based upon people who have disease processes in the brain. So if you have MS and your lesions are in a certain area, you may be more likely to get depression. Also, we know that people who have MS who are treated for depressive symptoms have less fatigue. So there's a benefit to being treated for your depression when you have MS. We know that some of the medications that treat MS can cause depression. But despite that, obviously we want to emphasize that if you have depression with MS, it doesn't necessarily mean it's from your medication. As a matter of fact, those are usually side effects. And I think oftentimes people recognize that the treatments may need to be taken regardless. And so you may have to be treated for the depression that the medication causes, and there's not a problem with that. Just be aware that that is an issue. We know for sure that aerobic exercise 100% decreases the incidence of depression and in individuals with MS. We know that both medication and cognitive behavioral therapy are together work better than either one alone. We know that for people who have MS. Once again, cognitive behavioral therapy is a type of psychotherapy that helps to change, to identify and change unhelpful, unhealthy ways of thinking, feeling, and behaving. And interestingly, MS patients have a certain personality changes that we see more often, and that is they can lose their ability to be empathetic. And they can also have some compromise to their theory of mind. What does that mean? It's a little bit harder sometimes for people with MS to put themselves in other people's shoes. That's a part of the brain that tends to get affected with MS. And not only can they have a hard time putting themselves in other people's shoes, but sometimes they're not as good at understanding how other people's unique experiences and cultural, social background, et cetera, can affect that person's way of thinking and doing. So that's something personality-wise that we will see in people who have MS. So the final message on this is that if you or somebody that you love has MS, please make sure that you are in the process of watching that person and having their providers be screening for depression, monitoring for symptoms of mood changes, and allowing that patient to have treatments both in the form of medication and or mind, body, spirit treatments that can help them to fight their disease process by also being on top of depression.